healthcare has become a consumer experience because people can choose to go to various other locations to receive their care. In addition to that, people are going to ask, are you providing me the best care? And that transformation means no longer are we the traditional healthcare mechanism of, listen, we're here, we're the hospital, we've got the doctors, you come in, you do what we tell you, you take what we tell you, and have a good life. Gone is that. Healthcare's transformed. People want to be no decisions made about me without me, right? That's a transformation. That's telling doctors you are no longer the solo voice in the care delivery. Patient, and not only the patient, there's family members as well who want to be able to provide input and their thoughts. And what does this mean for us? AI, for example, in radiology right now, we're still on a theme of breast cancer care. Typically, a radiologist, a woman has a mammogram has a finding, she's brought back to have a biopsy, any type of workup, and the images is taken. Someone, a radiologist, a breast mammographer, sits there, looks at the image, reviews the image, and they say, okay, we identify an abnormality here. Is it a cyst? Is it cancerous? Does it look malignant? We need further testing. What AI allows that radiologist to be able to do now is AI is so good that you can actually have multiple images. So think about multiple women getting their imaging done. Timing is of the essence. And the radiologist is able to teach the AI to look at the image and review the image. And the image, AI gets the first crack at it, says, hey, I see an abnormality in this image. Hey, I look at this image, everything's clean. This image, everything's clean. This image, there's something that we want to review. This image, everything's clean. So now you've actually increased the efficiency of the breast mammographer, the radiologist, to be able to look at the image. We're taking healthcare to the individual in their community, increasing the education, increasing the engagement. And that is for the betterment of the city of Dania, the city of Allendale, Hollywood, Miramar, Pembroke Pines, but also our emergency rooms are not being inundated with people coming for care because our emergency room becomes their primary care office, and now they're able to receive proper care. So when you are having a crisis and you show up to my emergency room, I don't have to be, well, I'm sorry, Ms. Knight, you're going to have to wait 2 hours because I have 50 people ahead of you, and of the 50, 15 of them could have been avoided.
Hello, and welcome to this week's episode of the 10X Blueprint Podcast. My name is Simone Knight, and I am your host. This week, my final guest of Season 1 on the 10X Blueprint Podcast is a healthcare industry juggernaut with 23 years in the business. He started off as an intern at Mount Sinai Hospital and is now an EVP and Chief Transformation Officer at the Memorial Healthcare System. On his way up, he served in many leadership roles at MHS, including VP of Oncology at Memorial Healthcare West, also CEO at both Memorial West and Memorial Healthcare Miramar. And now this man from Freeport, Bahamas, is a pivotal senior leader over the entire Memorial Healthcare System. He serves on the board of the American Society of Clinical Oncology. He travels around the world creating healthcare access and equity, especially focused on improving cancer survival rates for marginalized populations. He's my last guest of the first season of my podcast, and that is for a reason. I give you Mr. Vedner Guerrier. Vedner, how are you? It's so great to have you on the podcast. I'm so excited to speak with you today.
Good day, Simone. I'm doing well. Happy to be able to join you today.
Fantastic. Now, you and I just spent about 10 minutes trying to pronounce your name properly, right? It's pronounced Guerrier for those of you that are looking at it, but he gave me a cheat code to make it sound like Perrier. It's Guerrier.
That's right.
So, Vedner, I'm so thrilled to have you on the podcast today. As I said, you've had this long history, this illustrious career in healthcare, and now your focus is on healthcare equity and access to care, specifically really doing a lot with oncology, which is pretty interesting because that's why you and I met Fun fact, everyone, that's why Vedner and I met, was because of oncology. I was going through probably what was the worst day of my life and the time that I met him, because it was my first day of chemo treatments. And I was going through some issues, and he came in to save the day. And here we are about 11 years later talking.
Listen, you look fantastic. You look great. You're an example for others. I love the fact that you're able to use your story to enlift, to guide, and encourage others that cancer is a episode in life. It doesn't define anyone, and there are ways to overcome that.
With this episode, I know we're going to talk a lot about something that's near and dear to your heart, right? Healthcare equity and access. And I really want to talk a lot about the work that you're doing around that in this age of artificial intelligence and automation and responsible AI, where sometimes the technology can unknowingly disparage some other people. So I definitely want to talk a little bit about that. But before we get into all of that, always love to do rapid fire and really give my audience a chance to learn more about my guest. So having said that, Vedner, you grew up in the Bahamas. You got Haitian parents, right? That's where your family is from, your heritage. And you have a wife from Colombia. You speak fluent Spanish. How many languages do you speak?
I would say I dabble, right? I've been quite fortunate in my upbringing. So I speak 4 languages fluently where I feel comfortable. And Portuguese is my 5th language that I formally actually learned, and still working on it and getting significantly better.
Wow. 5 languages. Okay. All right. Well, now I feel like an underachiever. Okay. So we're going to move on from that. We're going to move on. All right. So I know that you spend a lot of time, obviously, traveling all around the world, some for work and some for pleasure, and you've been lived in many places. So tell me, where is the favorite place that you have been to that you're like, okay, this is, if I can have a little house with my picket fence and whatever you wanted, where is that place?
You know, that place for me is actually a little town outside of San Jose, Costa Rica, called Cartago. It's a farmland. It's a farmer's land near a dormant volcano. And Cartago gives you the feel of you're in the mountains. It's farmers. The people are very collegial, very appreciative of meeting someone from a different background, different culture, and they just welcome me. And it's calm and peaceful. And then I have the important things. I'm able to still get internet and air conditioning. So for me, it would be my ideal spot to build a little home with a picket fence and call it a day.
I absolutely love it. And you know what? I got to tell you, so Costa Rica is one of my favorite places too. The funny thing is that reminded me of Jamaica, where I spent a lot of time growing up with my family, and the people were so nice. The food is so fresh. There's just beautiful, exotic fruit everywhere. And the volcano, like you said, there's very few active volcanoes in the Caribbean, and Costa Rica has one. I think it's called the Arenal volcano. We stayed at this beautiful chalet and saw the volcano erupt. It was one of the best moments of my life. I couldn't believe that I was able to see something like that. So I'm right there with you. Costa Rica. Costa Rica is towards the top of the list.
That's right. Outstanding. Love it.
So let me ask you something else now, again, with travel. So again, you've been in the Bahamas and Haiti a lot from your own upbringing. Where's a favorite place for you in either of those islands?
Well, listen, I was born and raised in Freeport, Grand Bahamas. So Freeport by default is going to always be my favorite spot to be able to go back home and just feel and just remember, because all those memories of my childhood, growing up, engaging with others, learning about. Listen, I learned about the world being in the Bahamas because what happens as a kid growing up, you see these cruise ships coming in and you're like, where are all these people coming from? Because they sure don't look like us, right? Right? And my mom tells the story that I've always told her when I was a little boy, that I would say, one of these days, I will be going to where these people are from who are coming here to see the Bahamas. And so,
hey now,
blessed to be able to do that.
I love that because, that's where dreams are born, right? You see something new and different, and instead of being fearful of it, you're thinking, wow, I want to go where they came from. I want to go see those places. I love that. And for me, I see that or hear that story a lot in people from the Caribbean, where obviously, again, my heritage is from that. It's a very intrepid group of people, a very intrepid culture, where my own parents just picked up and left Jamaica and moved to England. Didn't know anybody there. And this is before they met and got married, so it's just pretty interesting how they used to do that. And things are not the same now. I don't think people are as adventurous to change countries now as they were before, but I love that spirit. So once you're going on these adventures, Vedner, if you were on a desert island, what is the one thing that you cannot be without?
That's a tough one. That's a tough question. I thought about it, right? So from a spiritual aspect, I would say, I'm going to be on a deserted island. I'm going to be there for a while. I have to take a Bible with me because there's so much, even now, reading, understanding, trying to appreciate what the word in the good book says. Even with all of the education and learning, there's still something new. You read a scripture and then you're like, let me put that in context to what's happening now today in my life, or something that has happened as a reference. I think if I'm going to be on a deserted island, it's going to be a lot of time for reflection, understanding, and appreciation of what I had, what I may desire. I would say from a spiritual perspective, I would say the Bible. I would say from a material perspective, hopefully I get a satellite phone. I'm going to have to make some calls. After those prayers, I'm going to have to make a call or two.
It's so interesting that you say the Bible because you are the second person on my podcast that has said the Bible for that answer as to your desert island item. But I'm also glad that both of you also said something practical that you would need to you really help you survive, right? So some people might be like, oh my God, I can't live without my hair gel. It's like, okay, how is your hair gel going to help you get off the island, get some shelter, get some food, the basics? Come on, people, survival skills. You don't need hair gel if you are the only one on that island. So I love that you said the Bible because I think, your own mental health in a situation where you can't move from where you are is definitely important. And I know that for a lot of people, the spiritual guidance and the peace of mind that comes from reading the Word of God really calms people. So that's a great answer. And I'm so glad that you're the second person that actually said that. All right. So now I have a question that I always ask called first jobs. And my theory is that the first job that you have helps you become who you ultimately will become in the future. And so what was your first paying job that was not from your parents or a family member?
So my first paying job, real job, was actually in healthcare. And that job was at Mount Sinai Hospital, Miami Beach, as a orderly transporter. And that introduced me to healthcare. So pushing patients around, I was able to take them to the ICU, from the emergency room triage to the cancer center. And I fell in love with radiology and radiation therapy. And that set my path and my destiny. One, healthcare. Secondly, oncology. And from there, I've been blessed to grow professionally.
Wow. On the nose. So that really was the spark for you. It's so funny. I asked that question to many people on my podcast. And even before the podcast, I got the idea about this whole first jobs thing, maybe I think back in 2018. And every time I've asked the question, it's true. Your first job really somehow helps you become who you are. Either it's the lessons that you've learned or it's directly the work that you're doing. But it's just, I don't know what it is. It's just really, really strange. Really strange. But okay. So, Mark, another one for Simone. First jobs, still working.
Well, I keep that in mind for my little one, because when he's going to get a first job, be like, no. You have to get the first job in this area.
No, you can't gatekeep like that. You can't be like, no. No, you can't force him, because you never know. Maybe his first paying job, not from mom and dad, might be mowing lawns, and maybe one day he has a gigantic landscape architecture company in Florida. You know that can happen.
That's right. That's what business.
All right. So as a former CEO, right, 2-time or 3-time CEO actually at MHS, Memorial Healthcare System, as Chief Transformation Officer in the healthcare industry still, what project has meant the most for you and why? Because you've gone through a lot so far, in terms of your work at Memorial.
When I look at it for what I've been able to do in the last 23 years, having worked for this healthcare system, I think the project that we're working on now, called the One City at a Time initiative, I think is a big thing. I think the biggest of all, for me personally, will be our new cancer center that we just opened. And the reason why is this. Over the last 23 years, unfortunately, I've seen the need in the community grow. And I've also seen the tragedy where patients receive cutting edge treatment, the newest treatment, and they're saying, no, but you need to go to Boston. You need to go to New York. You need to go to Texas, MD Anderson, Sloan Kettering, Dana-Farber. And it's like, no, that's not fair. That's not right. Not everyone can afford to get on a plane and go to these areas for 6 weeks, 8 weeks, 12 weeks. It's cost prohibitive. So what are we doing here in South Florida to be able to meet the needs? In particular, what is it that we're doing at South Broward to meet that need? So in our design of building the new cancer center, we've been able to take the programs that we have. We've pushed our physicians, in particular over the last 10 years, to be able to focus on cutting edge treatment when it comes to things that you hear like cellular therapy, where we're able to take your own body's immune system, weaponize it, put it back, and teach it to attack the cancer, not just with chemotherapy, but what's immunotherapy. So the fact that we're able to do that and we're able to deliver that here in Broward County for anyone in need of care in the Tri-County area, for me, is one of the greatest accomplishments that I have been a part of in my career. And it is phenomenal.
I agree. That is fantastic, because when you're in a situation where you or a close family member is going through the health challenges of a long-term care illness like cancer, anything can happen at any time. And to have your primary care physicians, for oncology being states away, it can be very difficult. And also all of the travel and all the cost and so forth. So I love the fact that you guys are doing that one city initiative, right? And bringing the care to the patients and making sure that their ability to pay is not the thing that's going to hamper their ability to heal. That is fantastic. Applause for that. Absolutely. All right. So a lot of big projects here. So, I was going to ask you, why is the Chief Transformation Officer role important in healthcare? But I think you're already starting to tell us why, because you've made so many transformations already in the roles that you've had.
That is correct. In addition to that, healthcare is transforming. No longer, think about it. Let's put it in the context so that I think age will give the perspective. Our parents, when they went to the doctor and the doctor told them XYZ, it was gospel. No one went to Dr. Google. No one picked up the phone and called someone that they know who might have had it. It was accepted. Now, healthcare has become, in particular here in South Florida, it's become a consumer experience because people can choose to go to various other locations to receive their care. In addition to that, people are going to ask, are you providing me the best care? And that transformation means no longer are we the traditional healthcare mechanism of, listen, we're here, we're the hospital, we've got the doctors, you come in, you do what we tell you, you take what we tell you, and have a good life. Gone is that. Healthcare is transformed. People want to be no decisions made about me without me, right? That's a transformation. That's telling doctors, you are no longer the solo voice in the care delivery. Patient, and not only the patient, there's family members as well who want to be able to provide input and their thoughts. And what does this mean for us? That aspect of care delivery, working with the physicians in my role as Chief Transformation Officer, I'm responsible for the physicians, the hiring of the physicians here at the Memorial Healthcare System. And when I'm hiring physicians, I hire them for cultural fit. I'm not looking if they're capable of doing a heart transplant or chemotherapy or whatever the case might be for their specialty. I have physicians who are going to test them for that. What I'm testing is for compatibility to, are they going to meet with the new transformation in healthcare is being asked of us by the patient. In addition to that, healthcare is transformed in that the patients are no longer the same. No two diagnoses are the same. No two stories are the same, because we see it. A patient of financial means, early stage breast cancer diagnoses has a higher probability of a better outcome from someone similar to them in terms of disease type, pathology type. But because of social determinants of health, socioeconomic factors. That person may have an adverse effect from, even though they're receiving same treatment, same doctor, same chemo, same radiation. Well, why did one person do so well? And why is this person struggling? There are a variety of factors. So all of this transformation that's happening in healthcare is why chief transformation officers are important, because the landscape is no longer what our parents experience healthcare to what now the consumer is asking us to be. And again, no decision about me without me. That's fundamental in my head whenever I sit and say, hey, we're going to do an initiative, we're looking to do an item, no decision about me.
So you mentioned a lot of things there that I want to unpack, right? So you talked about the fact that definitely healthcare has transformed. It has been under transformation, I think, for probably a couple decades, right? Slowly getting there. I think, with the digitization of records, with HIPAA laws, and the invent of WebMD, and people being just more aware of their vitals. We wear smartwatches now. We have trackers on our cell phones. You're getting sometimes benefit incentives at work if you go through your preventative care. So the patient, as you just pointed out, is much more informed than the patient was 20, 30, 40 years ago. And so that information and education now leads to empowerment, but also it can lead people down the wrong path. So now enter AI and being able to search up and create and do a lot of things. It's kind of like people are running with scissors now. And there's no supervision. So, how has that really started to change your business from what you're seeing with healthcare?
Absolutely. I think AI, Simone, has changed, and it's going to continuously change the way that healthcare is approached. Let's unwrap it, because there's various stages to the discussion, right? So AI, for example, in radiology right now, we're still on a theme of breast cancer care, I think. So typically, a radiologist, a woman has a mammogram has a finding, she's brought back to have a biopsy or any type of workup. And not only women, men also get breast cancer as well. So we take care of both men and women. But in this scenario, we're going with the woman as being the subject, and the images is taken. Someone, a radiologist, a breast mammographer, sits there, looks at the image, reviews the image, and they say, okay, we identify an abnormality here. Is it a cyst? Is it cancerous? Does it look malignant? We need further testing. What AI allows that radiologist to be able to do now is AI is so good that you can actually have multiple images. So think about multiple women getting their imaging done. Timing is of the essence. And the radiologist is able to teach the AI to look at the image and review the image. And the image, AI gets the first crack at it, says, hey, I see an abnormality in this image. Hey, I look at this image, everything's clean. This image, everything's clean. This image, there's something that we want to review. This image, everything's clean. So now you've actually increased the efficiency of the breast mammographer, the radiologist, to be able to look at the image. What do? They go back, they'll look at the ones that are clean to make sure there's nothing, no abnormalities, that AI didn't make a mistake, because AI is not perfect. AI is a learned algorithm. The radiologist teaches AI. Still today, I can take pound for pound, a radiologist is still better than AI. I put that with an asterisk, because they teach the AI becomes a lot more proficient and better. Now, the fact that we're able to go quickly through the non-finding imaging, it allows the physician more time now to focus on the findings. Is it a woman?
But you have capacity, right? You're building capacity.
Building capacity, building accuracy. But the one thing that we're starting to see with AI is once AI, those iterations become better, AI can sometimes identify things that the naked eye cannot.
Well, that is the hope, right? That they can do it faster, right?
It's the hope.
Use it as a tool, right, for speed and automation, but still with the human check.
Still with the human check. Very important. I am of that school that I believe the human check is still an important factor. But I think the fact that there are possibilities now where AI may be involved even in pathology to allow you to see maybe the cancer before the naked eye would see it it's just fantastic. You're like, oh my goodness, this is what we're looking for, because in cancer care, we know time, the sooner we can get it, the better we can provide care and the better the outcome for the patient. We're able to do that now. We're starting to see that in cardiology. We're getting to see that in neurology, the neurosciences. If someone has a stroke, to identify these things more timely. So that aspect of AI, phenomenal, fantastic, caught me in.
I love that. And it really resonates with me as a patient, because you don't know this about me, Vedner, but when I was in let's say, the gray area of whether or not there was something going on with me, first of all, two mistakes happened. One of them was a human error, which said that my scans were clean, which they were not. I actually got the wrong report. This did not happen at Memorial. This was somewhere else, and I'm not saying where, right? I actually received the wrong report. And it was because I pressed the issue that the right report was seen and that I was told what my diagnosis was at the time. That was the first error. The second thing is that, actually, no, that was the second error. The first error was that when I thought that there was something going on with my body, I was told after biopsy that there was nothing. Literally 4 months later, I went from no cancer to stage 2, just that fast. Yeah. So the question is, of course, what really happened here, right? So when you're saying that you now have this computer check and you have the human check, that resonates with me, where in my own personal healthcare journey, there were mistakes made. And wherever that those mistakes could be reduced and whenever speed can be made, especially in a situation like cancer where that can, get out of hand very, very fast, like literally in a matter of weeks, I say yes. I say yes, Vedner, let's do it. I know that some people are really afraid of AI in healthcare, and for good reason. In the use cases that you just talked about, to me, those are perfect use cases for leveraging this technology to help speed things along, improve the accuracy, see things that humans can't see, and basically be used as a tool to augment and make us better at our jobs in terms of healthcare.
Absolutely. That is correct. So I'm in agreement with you. And I think you just said something that's very important, that advocacy for self. Again, no decision about me without me is what has allowed you to be able to have a successful journey. And that's important. And we need to convey that to the audience, that you have to speak up. I don't say you're not supposed to trust what we tell you, but there's nothing wrong with trust but verify.
Let me tell you, my daughter was 5 years old when she did the trust but, no, I'm sorry, she was 3 when she did the trust but verify. She did it to Daddy right in the front. I was like, oh, wait a second, what just happened here? You learned that already? Trust but that. He was not amused. But yeah, there's a lot of things happening, and there's things coming at all of us at a million miles an hour, and you just have to advocate for yourself, just like you would if Starbucks messes up your coffee. Are you going to talk to them about it?
Correct.
It's the same thing.
But see, that's a good analogy, right? So Starbucks messes up your order. You're comfortable enough to be like, hey, listen, this ain't right. And you have a discussion with them. But a doctor tells you something, and you have people who walk away like, well, the doctor said it, then the doctor said he went to school or she went to school for this. It's interesting, how that aspect of it worked. And it's unfortunate that you had that. But again, I like the fact that you're comfortable in sharing that experience, because you're educating others. You're letting them know that they need to be their own advocate. There's nothing wrong with that.
Yeah. I mean, you're very passionate about this. So where did all of this passion come from, not only for oncology, because again, you're going around the world, teaching and talking and speaking about this oncology and advocacy and technology and the innovation and transformation that happens there with healthcare. So where did this passion for this field and for oncology in general come from?
I so often tell the people the story of my grandmother. My grandmother was born in Haiti, and she was one of many children, and she didn't know how to read and write. She did not have that opportunity of having formal education, but she knew the value of education, and she made sure that all 10 of her children that she was blessed with all had the equivalent of a high school. We didn't have, there was no cable, no TV. Had the equivalent of a high school and college education. I have uncles, engineers, aunts, nurses, and so on and so forth. And us, the next generation, we've done well. My sister's a physician, so we've done well in that. And so that push for education and that value that my grandmother had for education was so fundamentally important that when you learn and you got to give back. You got to give it back. So if education was a conduit and an outlet for my family to be able to achieve great things, so now that I'm educated in that, I know and I've been blessed with these opportunities, I would be guilty if I sat on the sidelines. So I have to be that advocate. I have to be that champion, and I have to be the person to push forward, because I have a lot of people who similar backgrounds, different backgrounds, who face these challenges. It has nothing to do with race, color, socioeconomic status. Sometimes it's just a lack of education. You don't know. And I know healthcare, and it's my job to impart that, or at least become an advocate for those who may not be necessarily be able to help themselves because they just don't have that education.
So that brings up an interesting point, because in some areas of the world, unfortunately, the gap between those with education and those without is actually growing. And that sounds really disappointing, especially when it comes to healthcare and access to healthcare. As we're talking about these advanced technologies and how these technologies, augmented reality, virtual reality, AI, how these are becoming more democratized, how do you see these technologies really changing or impacting the fact that there are so many people around the world that don't have healthcare equity? Do you think it's going to help, or do you think it's going to hurt?
I think it's going to help. I think so. There's a couple of things, right? One of the things that we're seeing right now, Simone, is the fact that technology is moving so quickly. We're able to come up with different things. So that means if I come up with a new drug, I come up with a new drug called Nightington. So I come up with a new Nightington, right? Normally I would have the patent for the next, because of the research and development. It took me a while. I have the patent for it. And Nightington belongs to me, and you and I are CEOs for Nightington, and we're going to try to maximize our dollar to do it. But the way that technology is going now, guess what? You have a patent for Nightington, but someone else is working on it. You're going to be challenged on it. So one of the things that you have to now look is, like, even in the developing nations, Nightington in the U.S. can cost $30,000, but you cannot go to Uganda and try to sell the Ugandan government Nightington for $30,000. But if you don't do it, there might be another company in Uganda who might want to be able to produce some form of Nightington, or look for a biosimilar, something in nature that can give you the same results as Nightington, and all of a sudden you'll be out of the game. So what are people doing? Companies are a lot more aware, more willing to work with developing nations. There's different pricing. So that's the advancement of AI and being able to help that. I think the other thing as well is that what we're developing is standard of care. We're developing healthcare pathways. Old school doctors will protest and say, listen, you're doing cookbook medicine, but not really. If you're able to show, if this person shows up with this type of medical condition, and this is the primary course, at least the initial course, that 80% of the people that we've treated with this has been beneficial, that pathway becomes public because it's used in society. The American Cancer Society, the Lung Association, the American Diabetes Association. So enough people are using it that even you and Mexico, you and Haiti can say, hey, this is that pathway. This is the course that we should do. Now, do you have the technical equipment? Do you have the necessary drugs? That's a different piece, but at least having a pathway, that ideally this is the course that we want to provide for our people, and that is happening. That's happening. I was in Singapore last year at the International Lung Conference, and I did a talk on high, medium, and low-income countries in terms of how to provide quality lung cancer care. And many of it was, okay, high-earning countries, share your pathways with the medium and low-income countries, so at least they have that pathway to say, this is a way to do it, and it at least gives them a head start to say, okay, what is it that we need? Government, and so this is what we need to be able to reach what is defined as the standard of care for this condition.
So, Vedner, I know that you are also a Lean Six Sigma Black Belt, right? You and I share that standard there. And I wonder, as you're talking about all of these transformations, processes, pathways, how has that background really helped you in this role in transformation?
It's been a blessing. It's been invaluable. So why? So often I have to explain this, so I'll explain this to the audience so they get it. So lean is removing waste. There are 7 forms of waste. In healthcare, there's actually an 8th form of waste, which is too many people. For example, somebody's coding, you're doing a CPR, you have the doctor doing a compression, you have the respiratory therapist giving the patient ear, and then you got a couple other people just looking over them to see what's going on. And you should be working doing something else. So I call that the 8th form of waste, the rubbernecker, the bystander. So lean teaches us to remove waste out of a process, right? Waiting, over-processing, doing too many labs, and so on. Then Six Sigma is having a process, making it be repeated on a repetitive basis with consistency. For example, if I bake a cake at my house and I give you the exact formula, you should be able to bake it. The challenge is island people. My mom would give a recipe and then I try to do it, but she forgets to say, she says a pinch of salt. What is a pinch of salt? Is it this much? Is it this much? And then all of a sudden my food is salty because my pinch was more than her pinch. So that's the concept behind Lean and Six Sigma. And as a black belt, I am able to use the methodology of understanding the process. What is the problem? What truly is a problem? Do you have data to say the problem? For example, I can tell you, Simone, traffic in Miami is horrible. I can prove data to challenge that to say, yeah, but Vedner, you're making a general statement. If I say, Simone, traffic to downtown Miami, out of Broward County to downtown Miami between 7 a.m. and 9:30 a.m. is a problem, you'll agree with me because I'm going to present data to support that. But I can argue with you that, Simone, I know you said traffic is a problem, but I can tell you, if I get on 95 at around 11 o'clock midday, for me to drive down to downtown Miami, it's not that bad of a drive. Traffic isn't that bad. So when we look at problems, in healthcare, I use that methodologies always. What is the problem? Provide me the data to show me that it actually is a problem. Let's use that data to figure out what part of the problem are we going to resolve, and then we work from there.
I love that what you're describing is the DMAIC method, right? DMAIC method of Lean Six Sigma to diagnose and basically identify the problem, come up with data, fix it, and then control it so that it continues to work. And in healthcare, it was born out of manufacturing, right, in Japan. And it's basically gone all over the world in so many different industries, even to the point where I myself led a team that we did that in media. And so it's interesting to be able to see that applied in an environment where there's art and you have to apply a science to it. But it's definitely that you can do that. And what I love about what you're saying is that in this idea of transformation, you need to be able to identify what are you actually transforming and why? What are we fixing? Is this the thing that needs to be fixed to get us to where we are trying to go? And so as things are moving at the speed of light with all of these emerging technologies that I mentioned earlier, AI, AR, VR, and whatever other R is coming down in the next 2 weeks, right? People are anxious to jump on the bandwagon, but they're also anxious to figure out what is this thing really? And one of the things that I encounter, and I'm interested to hear what you're going to say about this, is when people sometimes want to apply these technologies to their business, they're not sure what they're going to do with it. This is what I call the shiny object. So it's, okay, so how is this technology going to help you be better, increase capacity, reduce waste, or increase efficiency, improve your consumer engagement, is bring in revenue? What is it going to do for you? If we cannot articulate that clearly, same thing with designing or figuring out what the problem is. If you cannot articulate that clearly, then you're going to end up wasting money. You're going to end up wasting time. And in healthcare, you don't have time because literally someone could die if you do this wrong. So it's pretty interesting to see how that background is so needed in the role and how you're bringing that to bear in terms of bringing these access to care and health and equity in healthcare to the population that you're working with at Memorial.
I think you just brought up something, so I'm going to tie in that process improvement, lean with social activism in terms of doing the right thing to support the community using a process improvement methodology. The Memorial Healthcare System is a publicly funded healthcare system, meaning we are a taxing authority. We are able to tax the people of the South Broward District. We don't really do it in that there's taxation, but it's very minimal. To put it in context, I always put it in context in terms of numbers. Jackson Memorial, the largest publicly funded healthcare system in the nation, and Miami-Dade County collects $500 million of taxpayers' money every year. They use that to provide uncompensated care to the residents of the South Miami-Dade County, the whole county. In Broward County, we have two publicly funded healthcare systems. The Memorial Healthcare System, because we've been very financially stable and we've done well, we only collect $8 million. But that $8 million that we get from millage rate and from taxing, we get it on a Monday, we sign a check on a Tuesday for $8 million, and we give it back to the county municipalities. But that does not take away our need and our mission, actually, on why we exist, is to be able to provide care regardless of the ability to pay in the South Broward District. So how do we do that? We took the data to say we have 5 major cities that really make up South Broward: Dania, Hallandale, Hollywood, Miramar, Pembroke Pines. We see the constituents coming from these different areas coming for care. We identify what are they coming for care for? Uninsured or underinsured? What are they coming for? Hypertension, diabetes. So typical, what we call the killers, right? In our society at this time. And how do we address that? So we get the numbers to say, listen, there's a particular area in Dania where we're seeing X amount of people coming from, and they're coming pretty much for the same things. What can we do? That goes to what we had spoke earlier, the one city at a time initiative. So the Memorial Healthcare System, we have an adult mobile van, a pediatric mobile van. We go to that area, that zip code in Dania, that we know is a hot spot of saying people showing up with catastrophic medical conditions, stroke, diabetic comas, heart attacks, and we place that mobile van there for 3 days a week for 12 weeks, free. Anyone that lives in Dania, lives in South Broward, can go to the mobile van and get a medical checkup. What are we doing there? When we go there, not only are we checking blood pressure, sugars, it's that education. We're educating the person about their well-being. And if they say, oh, Vedner, I'm uninsured, we have a process on how we can help the residents of South Broward to be able to provide them some type of insurance or support coverage, because it is cheaper for me to provide care for you before you have a stroke. Because if you have the stroke, God forbid, you come to the emergency room and I'm able to save you. We're able to save you. What happens now? You need occupational therapy, speech therapy, physical therapy. Your quality of life goes down. And it costs a lot to take care of you. So how do we avoid that? The data is saying these individuals are coming. There's a lack of health care, or there's a lack of access to health care, be it we have made it difficult for them to come and get it. They have obligations that they can't. There are social determinants of health that factor in. I live in Dania. I have to take 2 buses to come to the hospital to see the doctor. Oh, by the way, all your doctor's appointments, 8 to 4. And guess what? I have to provide for my family. I need to work. And my work shift is 8 to 4. And so we understand that. So we are actively working to engage. We're taking healthcare to the individual in their community, increasing the education, increasing the engagement. And that is for the betterment of the city of Dania, the city of Hallandale, Hollywood, Miramar, Pembroke Pines, but also our emergency rooms are not being inundated with people coming for care, because our emergency room becomes their primary care office, and now they're able to receive the proper care. So when you are having a crisis and you have show up to my emergency room, I don't have to be, I'm sorry, Ms. Knight, you're going to have to wait 2 hours because I have 50 people ahead of you, and of the 50, 15 of them could have been avoided.
So now let me ask you a question on that note. So you're saying the data is showing you these hotspots, and that's why you guys are now doing these mobile vans, right? This one city initiative. and you're addressing these hotspots. Now, in terms of leveraging these technologies like AI, could AI help you predict these hotspots to see what's coming based on maybe whatever variables may be part of the equation that basically shows that there's a hotbed of, like you said, diabetes, stroke, the killers, and so forth? What about predictive modeling?
I would tell you yes, but it's scary, right? Because I can tell you right now, if you're a resident in the South Broward area and you give me your zip code, I can pretty much tell you most likely how long you're going to live. I'm probably going to tell you, meaning your quality of care. Because I know that you know, that's what you don't have a grocery store, you're not getting fresh fruits. Most likely, if you're going to be going to one of those corner stores, you're going to be getting processed fats and sugars and stuff that lead to the decline in your health care. So I can pretty much tell the age range. I can tell that if you're married and your wife is with child, it most likely there might be challenges in the space of higher probability of maternal fetal challenges, low birth rate, underbirth, complications for mom when delivering, more adverse possibilities of adverse outcomes. Yeah, AI lets us know all of that because we're collecting that information through our electronic medical record, Epic, and AI can collate that information. And that's how we're able to get, hey, listen, you had 50,000 ER visits this year. And of that 50,000, you had 10,000 that came from this zip code with this diagnosis. Yes, AI can absolutely do that. And it has been doing that. It shows us where those hotspots, that's why when we place the mobile van, like right now for one city at a time, we're in the city of Miramar. We're in the 3 hotspot zip codes by the community center there, where we know these are the areas in which the constituents of Miramar have been showing up to our emergency room. And we know what they've been showing up for.
You know what's also pretty interesting, alarming, and sad? You said something in there that's very key, and it's been an issue in many communities for a very long time. And that is food deserts, where you mentioned that you cannot get fresh, or it's very difficult to get fresh fruit and vegetables. So people end up going to maybe the mini mart at the gas station or something that has snacks, high salt, high fat, things that are not healthy for a quote meal, especially on a recurring basis. And to me, a predictive element of poor health outcomes is likely how far away is the nearest supermarket. And to me, that's a simple variable. If you don't have a supermarket within 2 miles or 3 miles, whatever that number might be, that probably tells you where there will be health challenges, like you said, maternal health issues, birth weight issues with low birth weight with babies. But this is not new news, Vedner. This is not new news. But things are not, I don't know that enough has been done in those areas.
Which is why we can't do it alone, meaning the Memorial Healthcare System cannot be the save-all for everyone. The Memorial Healthcare System can't do it alone. We know where the food deserts are. I can tell you, I live in Cooper City. I have 4 Publixes within a 3-mile radius of me, depending on which gate I leave out of the community. And I can tell you right here in West Park, there's not a Publix anywhere around. And so I can tell you, historical, what we used to call Carver Ranches, there's not a Publix, a Walmart, or anything close enough where it's convenient for you to be able to go. So you're absolutely right, Simone, and it's not new. Unfortunately, it is not new. We know this. So what do? We do the food. For example, when we do the One City at a Time kickoff, one of the things that we do is we do a food drive in which we give families fresh fruits and vegetables we hand out for free when they come in as well. And we try to help with their education, but we can't do it alone. So one of the things that, again, my passion is coming out, and one of the things I'm big about, when the American Cancer Society comes to me and say, hey, Vedner, how are you going to support us this year with our campaign? American Diabetes Association comes to us and say, how are you going to support us with our campaign? My answer is always the same. We are going to help you, but guess what? When we go to do a one city at a time initiative, when we're doing a health fair, we expect the American Cancer Society, we expect the American Diabetes Association to be there because you're going to help educate our residents of South Broward District, our fellow community members on the importance of what the work that you all are doing, why it's important, and letting them know how you can help them because we, the Memorial Healthcare System, cannot do it.
I love that because there's a combination of not only advocacy for the community, but partnership, right? To make more noise, right? Bring more hands to the table. And that is when you grow together. And I love that. So wrapping up this episode, because I think we can talk probably for another hour on this, but for other organizations in healthcare otherwise that are thinking about this type of transformations that you guys at Memorial have already been going through and maybe thinking about how they can leverage some of the technology that's out there and available to help with healthcare equality and in their area, whether it be out of state, because this is a national podcast, this is a global podcast, actually. People listen to it in different countries. What would you say to those other healthcare organizations in terms of what they should be looking at in terms of transformation, maybe some pitfalls to avoid, and how the technology can help them?
I think the AI platform is important. I believe getting the data, getting the information, we already know the problem, right? We know the problem. We know the challenges. It's getting the data to support, and no different than the old adage when they say, how do you eat an elephant? One bite at a time. And these are elephant-sized problems. So using the data, it'll let you figure out what is the most meaningful, impactful item that you can take on. And slowly but surely, we're going to change the tide of what's happening. It's not without headwinds. There are headwinds that we will encounter that may slow the process, but following the methodology of using data, working, and empowering not only the people that you're helping, but also the people that's on your team is beneficial as well to moving the needle. And also be comfortable about having the discussions, the dialogue. We meet with the community. We ask for their feedback. We ask where we have failed. What can we do better? And they have given us the feedback. I always go back to sickle cell. We were not doing well with our sickle cell patients. They came to a meeting. They told us, Memorial, you can do better. And right now, we've developed probably, I think, outside of Grady and Atlanta, a fantastic sickle cell program to address a need for a specific group that's impacted by this medical condition that for long, too long, had been under supervised or not appreciated challenges that they encounter. So any group taking on any initiative, utilizing the data, empowering the people that you're helping, but also empowering the people who are working on your team, and again, communication.
Absolutely. Vedner, thank you so much for being on this episode of the 10X Blueprint podcast. This information was great. The conversation, fantastic. I learned a lot, and I'm super excited about the work that you're doing with equity and healthcare access and oncology globally to many communities. And it's all brought you to this place, right? You started off, like you said, as the transporter at Mount Sinai with the orderly transporter. And now here you are, Chief Transformation Officer, and really taking all of that knowledge with you and making some amazing and important lasting changes for that better society in general. For that, I want to say thank you on the behalf of all the patients, all the healthcare patients, and everywhere, all the families as well. So I appreciate it. Everybody, look out for the Memorial Miramar. I'm sorry, not Miramar, but Memorial Healthcare vans out in your community. You mentioned, you said Miramar, Pembroke Pines. Right now, they're in Dania. What were the other two communities that you mentioned?
Hallandale and Hollywood. And we're coming to Pembroke Pines once we leave Miramar. So we're coming to Pembroke Pines next.
All right. Okay. Look out for that. And that's fantastic work that you guys are doing over at Memorial Healthcare. So thank you for that. And everyone, I will see you for season 2 of the 10X Blueprint podcast. We're going to take a little break and then we'll be back. Have a great day.
Thank you. Be well.